Hello, I'm Ian Scales, you're watching TelecomTV, and we're here at the Internet of Healthcare event in London, where I'm going to be talking to Dr. Jordi Serrano Pons, who is the founder and CEO of Universal Doctor. Jordi, welcome to TelecomTV.
Thank you very much for inviting me to this interview.
You're very welcome. Jordi, can you tell me about your background and about Universal Doctor?
Well, it came many years ago. I'm a GP, I'm a family doctor, and I used to treat patients from different nationalities, and it was very difficult for me to talk with them, to communicate well with them. So we decided to create a software that would help us to launch audios in many different languages, and it started as a 6 months project, and it's been at least 6, 7, 8 years at least running the project, and it's basically now implemented in more than 150 hospitals around the world using the web version, and you can download the app Universal Doctor for free. And we've been implementing that in social projects, for example, a project called Refugee Speaker. So we are giving the app for free just to help doctors talking with refugees that are coming to Germany. And and in that context then I moved to live to Geneva, Switzerland, and I've been consulting for different international organizations in aspects that have to do with digital health and development. So I'm very interested in how IoT, mobile health, digital health in general is going to help to improve health outcomes for people of developed countries, but also developing countries.
Yes, that's great. Tell me a little bit about how you see IoT today. Now we've had, as you said before, we've had this medical technology around, and e-health. It's been around for 20 years or so, but it seems the last few years there's been an explosion, and we're starting to talk about medical IoT. Tell us about how you see that inflection point.
Yeah, well, in any technology, there's sometimes it takes a lot of years to advance, and then from one moment to another, it explodes. Of course, there are big companies. They're having big companies working in e-health projects for many years, even at the late 80s, 90s. But of course, until the moment that everybody has understood how to navigate the internet, how to get information on the internet, until every hospital is connected to a bigger network, it was difficult to foresee how all this technology could help in the way that now we clearly see that a patient empowered with a mobile, with a smartphone, can really play a big role. A patient tracking himself can add a lot of added value to the system using wearables, giving that information to the system. So that's why the smartphone came in 2007, and it took just 2-3 years to be everywhere in our countries. So it can take just maybe very few years to IoT in the different versions, wearables embedded in the body, external wearables, whatever helps to collect data and send data to the system. It can take very few years for some, not all patients, but for some patients to get very empowered, and we're very confident of that.
So you started off with the translation software.
Yeah.
Tell me about some of the other things you're going to introduce as well. Where do you head to now?
Yeah, then I became very interested in everything that had to do with digital health. So basically, I've been involved in different projects that have to do with collecting data in low resource settings, and I'm very interested in new projects that have to do with behavioral change of patients, with mobile apps, with wearables, and I'm very sure that these things will revolutionize medicine.
So the combination of the mobile phone, the smartphone, the app economy, and wearables, could create a kind of virtuous cycle for data. Is that your idea?
We need to close the loop in that sense, because having information and not being able to change your mind about what you have to do, it's not correct. So once you have all the information, all the receptors, and the capacity to take a decision, so in more capacity and more knowledge, then it's when behavioral changes will change medicine.
So what's missing in terms of being able to close that gap? What are some of the things that you would like to see develop quickly and be put into place?
So basically, the data, a lot of data is being collected, but obviously, an example, you can have a wearable, and you can see, you can check your ECG. No, sometimes that information is given in a way that lay people that are not experts in something, cannot cope with it. There's some specific cases where anecdotes where a family doctor bought a wearable, and by chance he detected that, oh, my ECG is not very correct. Then I will go and go through a Holter, and thanks to that, he was 1 week later in under surgery, and they saved his life. Now, obviously, if a person that didn't have the knowledge would have had this lack. No, what it could be done is all this data received should be displayed in a way, in a more intelligent way for people who are not experts. To do that, we need interfaces with artificial intelligence that collects this data, and it's already worked out, and display in a way that people very easily understand what they should do, or if they're improving or not. No? Because just for people, and also for example, for family doctors, if you are a very engaged patient and you go to your GP, oh, I give you the data of the last 6 months. Well, it could be that because they don't have time or whatever, the doctor will say, okay, good. I suppose it's good. We need to really make intelligent systems, to build intelligent systems. And for that, you need a lot of old data from yourself that the system can analyze, and then can predict, and not only predict, can decide that because you had that in the past, now it suggests you to act in a different way.
Yes. So, for instance, the data, say it was a heart condition somebody had, and they're returning the data to the cloud, as we call it, over a long period of time. They're able to look at that because it's presented to them in an understandable way. And they could say, from what I've read, that looks a little bit like I'm building up a blockage somewhere on my artery. You could then take the next step of saying to the doctor, I want to come and see you because of this suspicious piece of data that I've been able to interpret from my data store. And then he can take it to the next stage, because he could be second line. So you could do your own triage in a way, couldn't you? So
well, triaging yourself, it's quite a danger, of course, but having empowerment with devices that really help you to know exactly what is happening, it's always better, no? Of course, thanks God, all the things have to do with chest pain, with head. Everyone is waiting for you, and if you pick up a phone and say you have chest pain, in 2 minutes you have
the ambulance turns up.
But obviously, in circumstances that are not so grave, but there could be some potential harm in some days. Well, I mean, all this technology will help to take action much faster, and of course, the triage of yourself or any triage that is done in the hospital. The more information doctors have, not from the moment you appear in the hospital, but for the moment that happened 24 hours before, it's much better. No?
A month before and so on. Yeah, exactly.
Much better.
Okay, that's really, really interesting. And as a doctor yourself, you must have, I suppose you can see that from your own experience, that people come in too late or maybe come in too early sometimes.
Well, right now, lately I'm very engaged in many entrepreneur projects that have to do with health, so I'm not visiting patients myself. I'm practicing lately, but I mean, we're involved in many projects with clinicians there start to be, you can detect some cases where because of a wearable, a decision has been taken. So slowly, these things will happen more and more. The question is how all this information can be one day added to your own clinical record, for example. Because now in some places, and it's been very difficult until now, in some places you can have your own clinical record in your mobile in a static way. You cannot still introduce your own data. But imagine that you have it from the government, NHS, or in America, or in other countries from other providers. You have access to your own clinical data. Imagine that you have other data, and you would like to inject that with that data, no? The structure, how this data would be added, all these things, once will be solved, will make a big difference. No?
Yes. One day.
One day.
That is a huge enterprise, isn't it?
Yeah.
Because you're talking about standards and
Yeah.
and so on, and
But slowly standards
slowly work towards
yeah,
it.
yeah.
Okay. Well, look, that's great. Well, thank you very much for that. Very,
Okay.
very interesting.
Thank you very much.